All right, first of all, I'd like to welcome everybody here to the city of Elmira and for this important announcement. I'm very happy with the big turnout we have today for our Congressman Nick Langworthy, who's going to discuss some issues dealing with Medicare. With that, I'll turn it over to our Congressman.
Thank you so much, Mayor. Thank you so much for everyone for coming out here today, and start off and wish everyone a happy Easter, happy Passover if you celebrate. It's a great season, and the best news is spring is here. And hopefully the snow is behind us. But I'm here today to talk about a very important issue that more than 1.7 million New York seniors rely on, and that's a program called Medicare Advantage. Now, Medicare Advantage is an extremely popular program. It's actually a great example of what's going right with health care. It's a public-private partnership that was designed to create competition in the marketplace, and the result is that seniors, they have access to many more benefits at a much affordable cost. Instead of just an emergency room visit being covered, seniors have access to critical benefits like dental and vision, hearing, and prescriptions, in addition to doctor's visits and their preventative care. It can also offer access to transportation and telehealth, which are critical services that matter a lot to seniors in rural areas like we have here in the southern tier. It's so popular that 98% of beneficiaries say they're satisfied with their Medicare Advantage plan. And 97% express satisfaction with their network of physicians, hospitals, and specialists. Now, as your congressman, and I know as your state senator, we'd kill to have 97% approval ratings. But Medicare Advantage is getting the job done for our seniors. And we have a very large population of Medicare Advantage customers here in the southern tier and in the western end of New York State. But despite that, the Biden administration has quietly, very quietly, put out rule changes to this program that will have a devastating impact on the ability to receive these services. In New York, the average senior is facing a $657 reduction in benefits for the year 2024. They pay an estimated 29% higher premiums for a far reduced benefit. Now, New Yorkers who are most at risk would be forced to forego treatments or incur a late diagnosis, where it might be too late, and they might suffer greater complications and incur higher costs in the long run due to chronic conditions that they may receive if they're not staying up on their preventative care. Now, seniors could also see higher out-of-pocket costs for prescription drugs, primary care, specialists, and hospital visits. Now, getting medical services is already a very stressful event. It's something that our seniors spend a lot of their time on. And the added stress of not knowing how they're going to afford doctor bills and prescriptions and everyday essentials, it's just not right. Especially when they've worked hard their entire life, they've paid into programs with the promises that these services would be available to them in their golden years when they're most in need. I have said from day one, I will always fight to protect Medicare and Social Security. And when I saw that the Biden administration Center for Medicare Services was trying to make these changes, I immediately went to work to try to bring stakeholders together to stop these changes to the program. And I'm proud to lead a letter that many of our New York congressional members have signed on to, telling the administration that we are vehemently opposed to any changes to reduce benefits or hike premiums for Medicare Advantage. Now, let's think for a second what an increase in premiums on that scale means for a southern tier resident or western New York senior on a fixed income with a limited budget, no ability to really make more money. You know, many of our states enrollees in Medicare Advantage, they live on less than $25,000 annually. And that $25,000 has already been diminished greatly by the highest inflation in 40 years. You know, whether it's the price of gas, the price to heat your home, whatever it is, it's all chipping away at our fixed budgets. And this is especially a tough blow for our seniors living on a fixed income. They're going to be forced to make impossible decisions between food on the table and life-saving medication. Now, heating their home in the winter or seeing their doctor to treat a heart condition. These are dilemmas that our seniors are going to face going forward if these programmatic changes go into effect. And it's unconscionable. And this administration, time and again, has shown to be completely tone deaf on the realities facing everyday Americans. They either don't get it or they don't care enough. But gone are the days where they have a rubber stamp Congress that's just going to push the administration's priorities through and let them get away with it. We have balance now in our federal government, and I know members of the majority are working, alongside me to help make these changes. And it's awfully ironic that you have a president in the minority in Washington that they're running around spreading lies that the Republican majority wants to actually cut Medicare or Social Security as we discuss the debt ceiling changes. That's 100% untrue. It's been 100% true since day one. McCarthy in our conference has said unequivocally, we will not cut Medicare and Social Security. Period. End of story. But in fact, it's President Biden in the last Democratic Congress who passed legislation that will lead to $500 billion in cuts to Medicare over the next decade alone. It's time to stop the charade, and let's do what's right for our seniors. Let's take the politics out of it and protect Medicare and Medicare Advantage. We're going to keep demanding the answers of the administration and fighting against these changes that will harm our southern tier seniors and hit our rural areas of New York the absolute hardest. So I also have a great friend here. I'd like to give him an opportunity to come up and say a few words. He's out there fighting for you, trying to bring some common sense to this budget process in Albany. State Senator Tom Elmira.
Thank you. Thank you. Thank you, Congressman. It's a pleasure to be with you, and I would say I share, first of all, Nick's wishing everyone a happy Passover and happy Easter going forward, and that's the reason that we're not in Albany today, because the religious holidays have interrupted our budget negotiations, and we'll be back at that again starting Monday, the day after Easter, and working hard to get a budget in New York that works for New Yorkers, that helps solve our affordability crisis in New York and stem the exodus of people out of this state. But the issue that Congressman Langworthy is here on today is critical in providing important health care benefits to seniors that need them, that deserve them, and have worked their entire lives to be able to get. And I'm just so sick and tired of the rhetoric that comes out of Washington, D.C. about how Republicans want to cut Social Security and they want to cut Medicare. Well, I can tell you that's not true. It's just the opposite. They're standing strong in Congress to fight back against these cuts. I support them wholeheartedly. And efforts in the states like New York, where they have a proposal on the budget table right now that would add a $1.7 billion cost to provide Medicaid to illegal immigrants, is totally the wrong priority. And our priority should be for our seniors and our citizens, yet they're looking to do these types of expansions that will only impact detrimentally health care being provided in this state. So, Nick, thanks for the opportunity to say a few words. Pleasure to have you here.
Thank you, Senator. It's always great to be here in Elmira. And now we'll take any questions the media has. You're going to let me off easy today.
Very shy group.
We can do one-on-ones too, off-topic stuff. I want to thank some of our seniors that have joined us, Mayor Mandel for certainly opening up City Hall for us, and so many great friends and folks from the Office of the Aging here to talk about this important topic. So thank you, and God bless you all. Have a wonderful holiday.